Hey guys, so today this video is actually a requested video. It is about some tools that you might use as a CNA, and you guys know that I've made a couple of these videos in the past already about catheters and ostomy bags and things like that, but this one is actually about the urine collection cup. This is the BD Vacutainer Urine Complete Cup Kit. And somebody asked me, I believe she said she was still in her CNA training, and she asked me how it works when the CNAs have to actually collect the urine from someone. So I'm going to go into the bathroom. No, I'm not going to show you any real urine or anything like that, but I'm going to use the water from the sink kind of as an example of my fake urine, so that you guys can kind of see what you're supposed to do and all of that stuff. And I'm sure you guys know how to do it already, but I just have some extra tips that I want to add into it, just in case you work in a hospital or in a setting where the nurse asks you to collect a UA. So that's what all of this is, and I'll tell you what everything is and all of that stuff when I get in the bathroom, so stay tuned. Okay, so this is the little kit. You can kind of see everything that's in there. I'm just gonna tear it open, and you have the little Castile soap towelettes. Now you know these will not have anything to do with you as a CNA. This is what you're going to give to the patient, or whoever you're collecting the sample from. Obviously, it would be considered a patient, but this is for the patient's use. So they're obviously for a clean catch, you know, yeah. It's to clean their little area. So we'll put that to the side because we don't really need that because it has nothing to do with the CNA. Then we have your two little vials. So this is going to be the UA vial that doesn't have the additive in it. You'll notice at the bottom there's nothing added into it. And then you have this one, which is the UA with the C&S preservative. So you'll see in the bottom there is that little preservative in there. So it just depends. Not all of them are going to want both. Some nurses just want this, and some will want both. Others will want you to just bring the cup to them and they'll handle this part. It kind of depends on the facility. Some facilities, they actually handle all of this stuff in the lab, but I have been and worked in facilities before where they actually have the CNAs, you know, transfer the urine from the specimen cup to the vials. So I'm going to show you how to do that, but there is something you need to know first. So obviously you have the little vial. This is where the urine will be, and this is where the little sticker would be for the patient with their identifying information, such as their medical record number, their name, their room, their doctor, all of that stuff. Now, this up here, it is important that you read this because there is a sharp needle right around here underneath the sticker, and I will show you that in a second when I show you how to get the urine into these. So I'm just gonna, for the purposes of filling up these vials and showing you how to do that, I'm gonna put some water in here. Now obviously urine is not gonna look like water, and it should never look like water, but it is important to know that when you are taking the lid off to actually get the urine for the vials, to put it in the vials, never touch the inside. Even though you have gloves on, never touch the inside of the container. So obviously this is not going for an actual lab test, so I can touch wherever, and it's not urine, it is water. So we'll just put that much in there. So we're gonna pretend that our person had a lot of pee. So obviously this is how it works. Now the reason why I said don't touch the inside, even though you're wearing gloves, is because some facilities don't have the lids like this that have the needle on it, to where you can just puncture this and the urine will go into the vial. Some of them you actually have to twist off the cap to get the sample. So, but a lot of times that type of system would be going to the lab, and the CNAs wouldn't have anything to do with that. So let me show this. So when you're going to do it, you can see in there, I don't know how well you can really see that, but there is a little needle in there. Hopefully you can see that. I'll try to get it closer. It is covered in like a little rubber, but I will show you how to do this. So we're just going to puncture this. And so let's say you wanted a UA, no additive needed. So what you're gonna do is where that little needle is, you're gonna put it in there and you're just going to push down. And I don't know if you can see that, but it's filling up. So it's gonna fill as far as it needs to, and once it stops, like it stopped now, that's where you're done, and you can just pull it off, and now you're good to go. It's not gonna leak or anything like that, and you have your urine, well, water in this case. But so there's that, and the same is true for this. You're just gonna do the same thing. So where the little needle is, you're gonna push down, and you can see it's filling it up, and it's gonna stop when it's full enough, and that's how it works. So when it's full and it stops filling up, then you just take it off, and there we go. So it's that easy. And if you have these cups, it's good to keep the little sticker right there, so then when you're done, you can just cover it back up again. I've seen some people do it to where they just leave it, you know, which it doesn't really matter if you're not going to be touching it and you're just going to dispose of it like you're supposed to. But in other labs, I've seen people where they actually like take the lids off and dump the urine out before they throw it out. So it's good just for, in that case, to put the sticker back over the needle, just as a precaution. So that's basically it. I hope that helped you guys. Here's your super diluted urine samples. So that's basically it. And then these would be sent off to the lab. Now, obviously, you're going to have a sticker that you would put on here that has the patient's name, room number, medical record number, all of that good stuff. And then you're going to want to actually have the lab bag, the biohazard bag, to put it in there, and you know, whatever requisition forms that you need to send along with it to the lab. But I hope that was helpful for you guys. Hopefully you enjoyed. If there's anything else that you guys would like to see, be sure to let me know. Any questions that I can answer or any topics you would like me to talk about, let me know that as well, and I would be glad to get it filmed for you. And with that being said, I will talk to you guys again in my next video.